Before surgery, two main points have to be considered. Has the cancer spread to other parts of your body? Are you fit enough to cope with surgery? Around 10% of patients are suitable for surgery, and 2 in 4 of these are likely to have their lung removed completely. All relevant healthcare professionals between them deciding what is the best course of treatment for you will have discussed your case. Before you have the operation, the doctors will run some tests. When it's time to go into theatre, the nurse will wheel you into the anaesthetic room. You will have a small needle inserted into the back of your hand to administer the anaesthetic, so you'll be asleep throughout the procedure. It's natural to feel discomfort directly after the surgery, but you'll be prescribed painkillers to help cope with this. The doctor will be able to tell you how the surgery went, and a few days later you'll be up and about. But a more detailed biopsy is needed to give you an accurate update on the cancer. The results of this usually take about 7 to 14 days, by which time you'll be recovering at home.
I booked 2 weeks off work. I saved my holidays and booked the 2 weeks off holiday, thinking I'll go in there, have my lung out and I'll be back to work and nobody will know the difference.
The surgeon came and said that they weren't quite sure whether they were going to take half my lung or all my lung. He wouldn't know until he actually opened.
And that's when it was decided that they would take the whole lung out rather than part of the lung. So I'm thinking, well, how would you manage with just one lung?
Well, I was wondering really what it was going to be like and what they would find when they would go in.
They came and gave me a pre-med, and the nurse coming with me, wonderful, nurses, went into surgery, and the next thing I knew, I woke up, I think it was about 2 days later. And it was just one of them things that the anaesthetic took some wearing off. Good stuff, I tell you. With the drains, and which they told me I would have a drain, but I didn't think. And I was hooked up to monitors and going, I thought, I'm in another world here, It's really, really freaky, The physiotherapy came to see me before I came out of hospital and said that, they tried to get you to move and exercise and things like that. But I think you find your own way of getting your own comfort, It wasn't a matter of the pain side of it, it was the discomfort,
But I mean, you're very conscious, obviously, that your skin is tight. And there's something there that wasn't there when you went to sleep. And you're wondering, really, well, I'm alive, I suppose, is a very, very big thing. I wonder what they've done. I didn't know whether I had half a lung or whether I had one lung instead of 2 lungs.
And knowing something was missing as well, because there was things going off inside you, when you feel hungry and you're rumbling, well, there's all this going off inside and you're thinking, what's happening inside there, And then you think, well, all that space is gone, what happens there? I never thought to ask, when I take this lung out, what goes in its place? It's really weird. It's a weird situation, But, in time, you get used to it,
It was only when I came home, that was nearly a month after the operation, and I thought I could knock a house down, because of course I'd done nothing except be looked after and fed and watered and stuff. And I came into the kitchen here, and the next day, or sometime during the next day, I picked up a brush just to brush the floor, and suddenly, of course, because there were these muscles here, it hit me that I wasn't okay. and that I would have to take things gently.
And I think, you know, that's the other hardest thing, is accepting it, that you've got limitations to what you can do.
If you'd like to know more about your particular surgery, talk to your healthcare team. They'll be happy to discuss the procedure and any follow-up treatment that might be relevant. You can expect to be in hospital for about a week post-surgery. Total recovery time to return to normal can take weeks or months, depending on your own circumstances. The side effects of surgery can vary by individual. Surgery can be painful, so it is essential that you have enough pain relief. Strong pain relief will be used after surgery to keep your pain under control. This can be given either directly into the spine through a small tube called an epidural, through a drip in your arm, as an injection, or tablets. After you get home, you should expect to feel sore. Most patients describe a heavy or tight feeling in the chest area. Numbness is also common, particularly around the front of the chest, the scar, and the drain sites. You may also feel occasional shooting or stabbing pains as the nerves and tissues damaged at the time of surgery begin to repair themselves. It's very important to take your pain relief as prescribed. If you feel that the pain tablets you're taking are not controlling your pain, ask your GP or your lung cancer nurse for advice. Don't wait in pain until your follow-up appointment, which may be several weeks away. Some shortness of breath is to be expected and is normal. When you're up and about and exercising, you may feel more breathless. This is also normal and shows that you are working hard enough. You will have to rebuild your strength and energy, and this could take weeks or even months. Breathing exercises and physiotherapy can help enormously, whether your symptoms are quite mild or severe. You may be feeling very tired after your operation. This is normal, and as a result of your body healing itself, but should lessen as the weeks go by. If it becomes an ongoing problem, then see your doctor so that they can check for infection or any other possible causes.